All right, good afternoon, everyone. Thanks for joining us today for our weekly COVID-19 update. I want to start by talking a little bit today about Thanksgiving bump, or maybe even lack of Thanksgiving bump. You'll see here in the numbers a little bit that neither of our systems, and I think they'll echo this as well, saw a significant increase as a result of Thanksgiving activities. And for that, my message is a big thank you to our residents and to people in this region, in this community, who took that call to action very seriously. And we're safe and we're smart and had safe gatherings over the Thanksgiving holiday. That is certainly appreciated. That diligence and safety is going to continue to be important in the months ahead as we talk about what the next steps are for mitigation in our community with vaccinations and so forth. And our healthcare partners are going to talk about vaccinations here in a moment. As we like to do, I want to take a quick look at the numbers that we've seen in the region for the last 14 days. While our case counts have also seen a bit of a decline, our positivity rate still hovers fairly high. We're not fairly high, it's high, in that 40% range typically. And what is more important, though, than that to us that we keep watching is that hospitalization number. And this trend line is obviously a positive trend line. I would say if there was maybe a mini Thanksgiving bump, you maybe see it there around the early part of December. But as of today, between Vera McKinnon and with Sanford here in Sioux Falls, those hospitalizations collectively in that 140-ish range is where we are. So it's nice to see that number declining. There are also a lot of people that continue, based on that, to remain hospitalized in ICUs. And so while the numbers are good, it's certainly not a time to relax. And with that, I'm going to ask Dr. Wilde here in a minute to join me. Dr. Wilde is going to talk about that enhanced mitigation that we have to continue to do here in the weeks ahead. One of those things that is going to be important will be what we're calling our One Sioux Falls COVID Action Plan. Our City Council meeting tomorrow night, a couple COVID-related items on the agenda. One is the requesting of the council to readopt this resolution. The One Sioux Falls COVID Action Plan basically just reinforces and asks our community to take seriously all the different steps and measures that are important to mitigation right now. And so these are some things that Dr. Wilde will touch on. The one that I really want to talk about primarily is right there. We're still asking and really, I don't want to say pleading because that's a really strong word, but this is the time to support our business community during this holiday season. This is when most businesses, they make or break their year in November and December, especially in retail. And so really would encourage you to support our small business community right now with that holiday shopping you're doing. A lot of those businesses have taken what we call the One Sioux Falls Pledge, north of 500 businesses, in fact. And those businesses are ensuring a safe experience for you, your clients, your customers, anyone, to go inside that business and know that they're taking the right hygiene protocols seriously, the right temperature measuring protocols, obviously the masking protocols that the city has put into ordinance they are following. And so that's going to be really important for our community and the resiliency of our economy to bounce back from this all next year as we move into 2020. So I'm going to not talk anything else about mitigation, as I want to leave that for Dr. Mike Wilde with Sanford. But first, we're going to hear from Dr. Dave Basil. Dr. Basil is going to talk about the vaccinations primarily, and as we've seen those on the ground here today in Sioux Falls, what that means for our community and how those will be distributed. So, Dr. Basil.
Thank you, and good afternoon. So we've definitely seen a nice gradual decrease in the number of hospitalizations and ICU admits that we've had over the last several weeks. I agree with the mayor. We have not seen that dreaded Thanksgiving bump, and so also we want to thank the public for their efforts in that regard. However, it's still a sobering reality that many of our ICU discharges come because of deaths in the ICU, and so this is still a very serious problem. We're still seeing very high numbers of very highly sick individuals, and so this is not over by a long shot. However, today is a joyous day. So as of 8:45 this morning, we received at Avera's shipping dock our initial allocation of Pfizer vaccine. So after being blessed by the sisters, it was put into the ultra-cold storage, and we intend to begin vaccinating with that starting later on, about an hour from now this afternoon. We're going to start as per the CDC and the state recommendations. We are going to start with ED providers, ICU, COVID units. The Pfizer vaccine, because of its ultra-cold storage requirements, will mainly be starting in the Sioux Falls area where we have the ultra-cold -70, -80-degree freezer. We expect in about a week from now that if everything goes as planned and the FDA approves the Moderna vaccine, that we will have even more doses of Moderna vaccine that we then will preferentially send to the rest of the state because it does not have the same ultra-cold requirements that the Pfizer vaccine has. And so within the next week to 2 weeks, we hope to have vaccine clear across the state of South Dakota. Wanted to bring up the fact that with this vaccine, you will need 2 doses. The second dose for the Pfizer is 21 days later. The second dose for the Moderna is 28 days later, and it's going to be really important that everybody gets both of those doses. After the first dose, it's only about 50 or 60% protective. After the second dose, it's when it gets up into that 90-95% effective, and we expect that to really extend the length of time that you're immune. Also important to know that this is a highly effective vaccine, one of the, if not the most effective vaccine I've ever seen produced. And the way that works is that the vaccine stimulates an immune response against the protein that it forms, and that immune response to the vaccine is what then will protect you later against COVID. But because you're ramping up that immune response, there's going to be anticipated reactive effects of that. And so you're going to have some soreness potentially at the site of injection. You're going to have potentially some fatigue, some headaches, some muscle aches, maybe even a low-grade fever. These tend to be very mild, limited to a day or 2 at most, and go away. That's not signs that you have COVID or that you've got influenza. This is just an expected sign of the immune system ramping up for that immune response that we need to fight that off. It doesn't mean if you don't have those responses that you're not protected. Some people will have them, some people won't, and still the studies show 95% of people are going to be protected. But it's just one of those things we expect. The CDC came out with some good guidelines over the weekend telling us, with healthcare workers, since they're the first ones going to be vaccinated, whether we need to exclude them from work depending on how severe the symptoms are and what symptoms they have, and so we'll be evaluating with those. Also, they can be mitigated with, say, Tylenol and ibuprofen, so we can give a lot of treatment that way as well. So overall, just a great day, one positive step forward. We expect to receive shipments of vaccine in small amounts, weekly or every couple of weeks going forward here for a while. It will start again with healthcare workers, especially frontline and ED, ICU, and COVID units. After that, it'll move on to long-term care staff at about the same time in nursing homes. Then after that, it'll go to nursing home residents will be the next place. So within the next couple of weeks, we think that we'll be able to get nursing home residents started to be vaccinating across the state. And then after that, it moves on to other higher risk categories, things like congregate living, those greater than 65, those in high-risk occupations, first responders, and so there's a whole kind of stepwise process of getting everybody immunized, and it'll depend how fast we can move that, just will depend on how big the allocations on a weekly basis is, and we don't know that for sure yet, and so we'll just have to see how rapidly we can get moving through. I imagine it's going to be a multi-month process to get through this, but we will get there, and we will continue to follow the CDC and the state guidance on who those priority groups are, and we will get shots in arms just as quickly as we can. Thank you. Next, Dr. Willie.
Okay, thanks, Dr. Basil. To update from a Sanford standpoint, we have seen a slight decline in the number of COVID patients in that 55 to 70 range currently actively being isolated and treated for COVID. We still have several other patients who are out of isolation but have needed to remain in the hospital as well. And we continue to serve, the upper Midwest region where facilities have been reaching out to us to continue to seek care, and very proud of our staff and how hard they're working to continue to try to prioritize care for patients as close to home as possible. Dr. Basil gave great information in regard to vaccination, and we appreciate the cooperation we've had not only with other healthcare partners in the state, but also the state of South Dakota, in addition to the federal government and the city of Sioux Falls as well. Obviously, we are preparing to begin vaccination as well. We also continue to use treatment if someone is COVID positive with the outpatient infusion of monoclonal antibody, and starting to see some evidence that does reduce hospitalizations as well. And so we continue to use that as well. As the mayor alluded to, really talking about where we're at, how we can help ourselves going forward. So really, the first message there would be continue to take care of yourself. Work with your primary care team, work with your specialty teams. We've talked about that now for several weeks, that it's okay to seek care. It's okay to take good care of yourself. Continue to work on the nutrition, the exercise, and all those things, because those really to take care of those medical conditions and optimize your health, and really working on that mental health as well going forward. While we're seeing some decline in the cases, we've always had the ability to care for other needs as well, because obviously other illnesses happen during this time, and we want to assure people that if you need help, it's okay to seek that. We have the ability to care for you, and we're going to continue to do that, and we do not want to see the ramifications of delayed care, because that can be very difficult to deal with, specifically for the folks out there themselves, that we want to get ahead of things as we can. And so please continue to reach out and seek that care. In regard to COVID, obviously still a very serious infection that is going to be with us for the foreseeable future. Some patients get very ill with this infection and can have significant consequences. And so I think it's really important to continue to take good care of yourselves. Unfortunately, you probably do need to look at your Christmas plans, just like everyone did a fabulous job looking at their Thanksgiving plans, and sincere thanks for that. As you look at the Christmas holiday, unfortunately, it's probably going to be another 2020 holiday. And as you talk to people, it really sounds like they are being attentive to what makes sense for their family during this year. And really the same message that we've been talking about over and over again, and that is staying home if you're ill, washing your hands, masking. And I like the point too about patronizing the businesses, because the mental health and frankly the physical health of anyone trying to work with the ramifications of this pandemic. There's a lot of businesses, not only in Sioux Falls, but in communities outside of Sioux Falls, that are doing a very nice job with your safety in mind. And as I frequent some of these businesses, they really do a good job, and they're working hard. And I think I appreciate that, and I try to patronize those that are really doing a nice job. So with that, I think there is some clarity that we can see toward the end of this pandemic, but it really is vaccinations, it's the monoclonal antibody infusions, but it's really taking care of yourself as well, to do the things that we've talked about over and over again with the hygiene, the distancing, et cetera. And together, I'm optimistic that we can have a better year in 2021. So with that, I'll turn it over to questions.
All right, thanks, Drs. Basil and Wilde. Any questions for myself or either of the docs today?
Mr. Mayor,
Yeah.
Will you take the vaccine, and when it will be available to you for that opportunity yet?
Yeah, so the question was, would I take the vaccine, and do I know when that will be available? Absolutely intend to get my dose of the vaccine. When it will be available, I suppose when when the 43-year-old beat-down politician category is ready, then I'm ready to take it. But don't intend to jump in line or get it ahead of anyone else. When it's my time, I'll take it. But I think that's part of the role that we have as leaders in the community too, is to show the safety and our comfort level with this vaccine. And I know that's probably one of the biggest tasks we have ahead of us, is creating confidence in the market for this vaccine. There is some hesitancy that people have, and some of it's justifiable. The vaccine won't be mandated. People have the choice to whether they want to take the vaccine or not. But hopefully my actions will represent my comfort level with that, and I hope my family will be vaccinated as well along with me.
So can we shoot that video?
I'll take the vaccine on camera, absolutely. Yeah, no problem. Other questions?
For Dr. Wilde.
You bet.
Dr. Wilde, can you tell us exactly how many doses of the vaccine Sanford has received in the Sioux Falls area and throughout Sanford, and when those vaccinations are starting?
Okay, so the question is, how many doses has Sanford received and when will those be starting? Off the top of my head, based on information I was reviewing last week, I believe Sanford is has received 3,100 doses, and we will start vaccinating as we've worked with the state on their guidance. Tomorrow afternoon is when we'll start giving those out.
Other questions this afternoon? All right, seeing none, we will adjourn this baby. Thank you guys, appreciate you being here.